On Wednesday, April 9th, ASN President Sharon Moe testified before Congress about the need to spur innovation in kidney disease research. In her comments to the House Science, Space, and Technology Subcommittee on Research and Technology, Dr. Moe voiced support for federal prize competitions as a mechanism to incentivize new approaches to renal replacement therapy that could reduce escalating Medicare costs and improve care for the 450,000 Americans with kidney failure and the more than 20 million Americans with kidney disease. In this episode of the ASN Kidney News Podcast, ASN Manager for Policy and Government Affairs Rachel Meyer speaks with Dr. Moe about her testimony and the benefits of using prize competitions to accelerate innovation in kidney care.
Dr. Moe, tell us briefly what you testified about before Congress this morning.
I testified about the imperative need for innovation in therapies to treat kidney failure, and how a prize competition sponsored by a federal agency could help incentivize that much-needed innovation and investment.
And what exactly is a prize competition, Dr. Moe?
So these are competitions where there is a one-time monetary award given to a team of individuals, scientists, inventors, innovators for a specific goal. That goal is put forth by a government agency or office or from nonprofit companies such as the X Prize Foundation. Eventually, what this is meant to do is to actually jumpstart in areas where there is scientific and ingenuity exists, but perhaps it hasn't been combined together to tackle an unmet need. Dialysis therapies or renal replacement therapies fit perfectly into the niche where a prize could be perfectly suited.
And could you elaborate on some of the reasons why innovation in kidney disease would be such a good fit for a prize competition, as you articulated to Congress this morning?
Well, as I mentioned, we have 20 million Americans that have kidney disease. 450,000 of those are receiving dialysis through the Medicare ESRD program. It's the only federal entitlement program that provides coverage regardless of age or disability, but it's costly. So caring for people with kidney failure costs Medicare nearly $35 billion annually. Patients with ESRD account for less than 1% of the Medicare population, but their care constitutes 7% of the program's budget. It was a worthy thing to begin the ESRD program in 1972, and there were a lot of initial advances that led to current dialysis. But in the last 20 to 25 years, those innovations have been stagnant, and it's time to jumpstart that again so that we can improve the quality of life of many of our patients.
So you just articulated that there are a lot of people affected by kidney disease and that it's a really very costly program for the federal government. How do you envision a prize competition could actually help achieve those goals of better outcomes for patients and lower costs for taxpayers?
Well, it's hard to envision exactly what the ultimate output would be of a prize competition, and that's kind of the point of a prize, is to really think outside the box. So it could be an implantable kidney, stem cell-based therapies. It could even be new vascular access or a way to recirculate or recycle the water. All of these things are possibilities, either alone or in combination, to improve dialysis. Ultimately, because dialysis costs a lot of money, but also because the patients who are getting dialysis generally don't feel well, they're not able to work, they are hospitalized more often than the average patient, they require vascular access procedures, and they take a lot of medications. And any one or all of those components of Medicare costs could actually be helped with ingenuity and innovation through a prize.
And who are some of the actors that a prize competition might potentially attract to compete for this pot of money you described?
So you could imagine bioengineers, biotechnology companies, matrix biologists, cell biologists, informatics individuals. All of these types of specialties can actually come together to create a better dialysis, a different dialysis, an alternative to dialysis. All of these things are, importantly, not even imaginable at the present time. Prize records have a strong record of driving innovation where it's best needed. So, for example, prize innovations led to a better oil spill cleanup technology, to 100 mile per gallon efficient cars, to gloves that keep astronauts safer, to space flight that was done by the public instead of NASA. So all of these things are really important and were novel, and you could identify the need, But before the prize was named, the solving of that need was not yet thought of.
So it sounds like there's a lot of potential for innovations within federally sponsored prize competitions, but what else is ASN doing to promote innovation in the kidney space? What are some of the other initiatives the society is working on?
Our biggest thing has been the formation of the Kidney Health Initiative. Now, just a little not quite 2 years old, we have over 65 members. These member organizations range from the ASN and FDA, who are the co-leaders in this, but also many other patient care groups, pharmaceutical companies, device manufacturers, biotechnology companies, startups, dialysis providers, every kind of company that's in the kidney space. These people are motivated to enhance innovation, to identify barriers to innovation, and importantly, to figure out solutions to rectify those barriers. So the Kidney Health Initiative, I think, is a big boom in the kidney space to get us all in the same room and figure out how to do things better. In addition to the Kidney Health Initiative, the ASN has the Foundation for Kidney Research, where we are funding grants for medical students, trainees, residents, fellows, and for career development awards. In addition, we have an aggressive new research strategy within the ASN. First, we're going to be asking for a GAO report to identify if the expenditures on kidney research is appropriate for the level of the disease. In other words, we spend $35 billion a year on dialysis through Medicare. Are we actually trying to innovate to lower those costs through research? A GAO report will actually provide real data that will actually hopefully incentivize more spending on kidney research. In addition, we have asked for an appropriation, a line item appropriation of $150 million per year over 10 years. This is an important ask, and it's similar to what was asked many years ago for type 1 diabetes. That ask for type 1 diabetes has led to revolutionary treatments such as insulin pumps that deliver and measure glucose and deliver insulin, and many other innovative therapies. We need the exact same kind of motivation to fight kidney disease.
Well, Dr. Moe, thank you so much for taking the time to share some of the exciting and up-and-coming opportunities for innovation. We appreciate your time. Thank you.
My pleasure.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.